You're looking great. All you have to do is floss every single night and you should be good to go. Oh, hey, didn't see you there. I'm just finishing up with a patient right now, but now that I have your time, how about we talk some policy and dentistry so you can hashtag be woke ASDA. Let's start off with one of the big boys, or should I say girl, Elsa. And to your probable dismay, I'm not talking about Frozen's Elsa, I'm talking about the Ensuring Lasting Smiles Act. A considerable percentage of our youth are dealing with chromosomal disabilities such as ectodermal dysplasia and cleft lip and palate. If patients that have to deal with this have to deal with defective enamel, misshapen teeth, and even completely absent dentition. If these patients don't get any treatment, they have issues with swallowing, speaking, chewing, not to mention all the issues revolving around self-esteem. Unlike Frozen's Elsa, we can't just tell these kids to let it go. And I haven't even started talking about the medical bills. Each procedure is insanely expensive with a capital E. And on average, each patient receives at least 3 surgical and reconstructive procedures in their lifetime. Families frequently find themselves selling their homes and properties just to afford their kids' treatment.
Hey!
Oh my God, my patient, I need to run. Hey Allie, you want to take it from here?
Sure.
All right, here you go.
Great. Recently, dental insurance benefits would not provide for those who are missing teeth as a result of ectodermal dysplasia. These providers may have provided initial treatment, but then denied coverage later on, saying that these procedures were primarily cosmetic in nature. ELSA hopes to change that. ELSA will change current financial-based legislation to ensure that individual and group financial companies will provide holistic care for patients with congenital defects or abnormalities. Now that's pretty awesome. And it's not the only bill in progress right now. Take it away, Mary.
There are actually more policies that are being introduced recently with the goal of providing more access to care. One of the more recent ones passed is the Dental Health Act. This initiative serves to fund efforts to expand oral health education and disease prevention, as well as work toward developing more dental homes in both urban and rural centers. Other key points in this policy include eliminating language and cultural barriers to care, reducing emergency room use for dental procedures, and integrating dental care into nursing homes more effectively.
That's great and all, but sometimes access to care is difficult because of restrictions from my insurance. Are there any policies that challenge that?
There sure are. One in particular is the DOC Access Act, first introduced in 2017 and then again in 2019. The bill has 2 main points. 1, it would prevent federally regulated insurance plans from forcing dentists to discount uncovered procedures. 2, it would limit the insurance company's influence over what labs the dentist can use and what medical professionals they can collaborate with. Ultimately, these changes will give our patients greater access to the treatment that they need. And while our future patients matter a lot, it's also important to think about policies that affect us as dental students and future dentists, especially with paying off our student loans. Let's talk about some of these policies.
First, we have the Residential Education Deferred Interest Act, or READY Act as we call it. This act works primarily to reduce interest accrual for students while they're in residency. This legislation would assist in minimizing the overall student debt burden, allowing students to pursue opportunities that they want, like those in public service that we so desperately need. Next, we have the Dental Loan Repayment Assistance Act, which works in a similar objective. Many programs are finding it more and more difficult to recruit faculty, largely due to the increasing amount of student debt. This legislation is proposing 5-year contracts for those students pursuing careers in academia in exchange for payment on 10 to 30% of their total student loan balance per year of service. I think we all can agree when I say that tuition and student loan debt has been on the rise in the past decade. With no end in sight, I think it's important that we take a look at acts like these to help reduce that overall student debt burden and to help other health professionals pursue the careers that they want or that this country needs.
So these are just some of the greatest hits in terms of our current dental policy. And of course, there are some more in the horizon. As with anything, lobbying for causes that you care about can tip the scale in favor for a better future for us as dental students, us as dental professionals, and probably most importantly, for those who are underrepresented and underserved. Be the change you want to see, and advocate for those changes so you can improve oral health at a national level. And don't forget,
Be woke, ASDA.
Be woke, ASDA. Be woke, ASDA.
be woke ASDA!